You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. How can you be that ignorant?
Breaking tonight, President Trump's controversial health secretary takes intense fire from Democratic senators and gives it right back to them. Robert F. Kennedy Jr. was criticized for his vaccine policies, the mass personnel changes at the Centers for Disease Control and Prevention, and his overall management of the agency. Senior congressional correspondent Chad Pergram starts us off tonight from Capitol Hill. Good evening, Chad.
Aisha, good evening. Robert F. Kennedy Jr. entered a hostile arena today. His Senate hearing morphed into a verbal judo match. He sparred with members from both sides over science and politics. The heart of the conflict, turmoil at the CDC and vaccines. Senate Democrats unloaded on Kennedy.
Sir, I'm asking the questions. You are the witness.
And, sir, you're a charlatan. That's what you are.
Should resign.
But the secretary gave as good as he got.
You're making things up to scare people, and it's a lie. This is crazy talk. You're just making stuff up. You're so wrong on your facts.
Kennedy's new COVID booster guidelines roiled the hearing.
So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one.
Even the Senate's number 2 Republican, a doctor, vexed by Kennedy's vaccine positions.
In your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned.
Republican Tom Tillis warned Kennedy to tread carefully.
We're playing with fire here. If the death rates go up for children who aren't vaccinated, they need to own it.
Kennedy's firing of former CDC Director Susan Minares 29 days after the Senate confirmed her stunned lawmakers. Kennedy accused her of lying multiple times.
Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
GOP Kansas Senator Roger Marshall, also a physician, defended the firing.
But unfortunately, she's not part of the president's mission of Secretary Kennedy turning this place, CDC, upside down.
Vice President Vance came to Kennedy's defense. He posted that the Democrats' gotcha tactics were, quote, full of blank, and everyone knows it. Kennedy said he may fire others at the CDC. When asked if he had any closing remarks, the secretary said no, adding, quote, I'll have mercy on everybody and let us adjourn. Aisha?
Okay, Chad Pergram from the Hill for us tonight. Chad, thank you.
I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way.
You've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing.
Yeah. It's a Maha meltdown. RFK Jr. defending his vaccine policies against Democrats on Capitol Hill, furious over his ousting of the CDC director. Jr. says it's time for new blood at the health agency after they failed Americans during COVID.
CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself.
And from there, the Dems came unglued.
You're so wrong on your facts.
You're interrupting me. And, sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines.
Because you are citing data that you won't produce to the public.
You're just
and you
making things up.
Rejecting
You're
science.
making things up to scare people, and it's a lie.
Mr. Chairman, the Secretary of Health and Human Services doesn't know matter how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant?
I never promised that I was going to recommend products with which there is no indication.
When you said.
And I know you've taken $855,000 from pharmaceutical companies, Senator.
On behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time.
Wow. Dana, you were covering this all day.
Yeah.
What did you learn? I'm sure you learned a lot about health.
As I was saying in the green room, they all lost me today. And to the point that I pulled out my IFB. I couldn't even listen to it anymore. I was extremely frustrated. I think these issues are very important. It affects everybody. And I think sort of like the debate when you have 10 people on stage and the format that we have and the time that you have, I think that's a broken system. I think these hearings are totally broken if the goal is to get information and to have a free flow exchange of ideas and information, because that is not what's going on here.
Then what do you think the goal is?
And Republicans and Democrats both do this. The goal is to try to get a gotcha moment, so where you try to figure out some way to capture this guy, but they don't ever give him really a chance to answer. And he interrupted them constantly too. So I finally said, enough. One of the goals is to get yourself on cable TV, right? So if it's MSNBC or Fox or CNN, wherever you want to be. You also want to figure out some sort of soundbite so that you can get some small dollar donations, because that's where a lot of this comes from. I think that these issues, to me, I'm not a mom, so I'm looking at this from a spectrum of MAHA, right? I like a lot of the nutrition stuff. I've covered the food pyramid stuff since the mid-90s when I first worked on Capitol Hill. I understand all of that's broken. But I'm not I can talk about a lot of things. I am not an expert in public health at all. I have to outsource that. And I don't want to ever I don't want to be a Google doctor, but the other night, Kennedy, I was actually texting her about where does she go for a doctor? Because I'm like, what about this and what about that? And if you're over 50 and then they're women, and then there's all this all the guidance is different. Everything's different. So now that's all true for children as well. So it's complex and it's complicated. And all these people did was yell over each other to the point that I couldn't understand or hear anything. They completely lost me.
Yeah. I think, I feel your pain.
Thank you.
Yes. I can give you a recommendation. I can give you a recommendation for a few doctors.
Great.
They practice out of a van, though, Jesse. You look at these politicians that are grilling RFK Jr., they don't look like they're in excellent health.
No, Wyden looks terrible.
Yeah.
And he's probably the best looking one out there. But these people oversaw an obesity epidemic, a birth rate plummeting, testosterone plummeting, autism skyrocketing, and they did nothing about it. And then they get on TV and they act like this guy is the bad guy. This guy was hired to clean house. If he came in and didn't fire anybody from these agencies, he should be fired. That's what this whole agenda is about. You take these people who industry puts there, they rubber stamp everything from food additives to vaccines, so it's profitable for the industry, and then they destroy any evidence that a study has. He came out and said they were destroying evidence of a study that showed black kids were getting side effects from a shot they didn't need, and the Democrat senators didn't even care. They accused him of killing people. And it's sick because they're saying he's anti-science. All he's saying is we're going to put in some unbiased scientists. They're going to look at the facts. And if it's still okay to have these shots at a young age, and if it's still okay for some of these drugs to be prescribed, that's fine. We just want to look at the underlying data. And that's not controversial. In fact, that's the scientific method. And the people that are saying this guy's anti-science were double masking. They were face shielding. They were shutting down beaches and parks and schools. And they actually think Joe Biden's healthy. And they think you can power the world economy with windmills, Greg, with windmills. Talk about anti-science. So I'm glad he went up there and battled these people. This is a big battle. He is the most popular member of the cabinet, and Maha is the most bipartisan, popular piece of this agenda. I think we can all agree, if we've been to the beach recently, that we don't look so good, and it's not a coincidence that we stopped looking good after we added all this stuff to the food, upped all the shots, stuck our faces in the screens all day. All of a sudden, we're popping pills and we all look horrible, and we're spending $1 trillion a year A year to make ourselves healthier, and we're getting sicker? We're the fattest, sickest, and most mentally ill we've ever been. And this guy's the one guy that was sent in like a heat-seeking missile to blow the place up. Good. I say blow it up. And if you're against it, then you want America to stay sick.
Wow. Jesse. You know, Kennedy, they were really circling the wagons around the CDC, and he took it apart in that one clip there. But it's like, why can't CDC answer for some of the decisions they made?
Or for some of the businesses that were shuttered. Or to his point, before he testified today, he published an op-ed in the Wall Street Journal showing some of the fallout from COVID, the lockdown, shuttered schools, closed businesses, arbitrary 6-foot distancing rules, and all these things. So the difference between RFK Jr. and, a lot of other cabinet secretaries is he has been passionate about this work for decades. And someone like Interior Secretary Doug Burgum, I think he's fantastic. I think he's had a lot of success as a governor in his state, and he knows a lot about energy, but he's not been fueled by this the way RFK Jr. has. And that's what's frustrating to a lot of the senators is he has answers for these things. And he has a team of advisors that he has been working with. And I disagree with him on a lot of stuff, but at least he makes me think about vaccines.
Yeah.
At least I have conversations with people who are having babies now, and even the schedule that they're giving kids now is vastly different than 16 years ago, the last time that I had to have these sensitive conversations with the pediatrician. I think that's the best thing we can do as a society, and have these honest discussions about how we look and what we're putting in our bodies and the solutions we're giving our children when we're failing them, when all of these institutions are failing him. So if Trump was elected to be a disruptor and to dismantle things as a limited government libertarian, I cheer that, even if I might have some fundamental issues with what he's saying. I believe in the work that he's doing.
You're right. I mean, just aside before we go to Harold, I didn't look at vaccines obviously until I had to. I knew about it, but like the Hep B vaccine, they like your baby has to get the Hep B vaccine. And I go, well, what are the risk factors? Well, if your mother has Hep B, and how did you get it? Well, through syringes or having sex with that. It's like, we're not in that group.
No.
We're not in that. Well, you know what? You should still get the vaccine as a community preventive thing. I go, what does that mean exactly? My kid doesn't need this. And yet they tell you that it's required or suggested. And if you say no, they make you feel guilty. I think that's it for tonight. So, Harold.
So I have a slightly different opinion about this than the people around the table on a couple of different fronts. I have kids like you do, and in New York City, your kids can't go to school unless they have a certain number of vaccines. And my wife and I put our kids on a schedule. They got their vaccines. We ask questions, but we adhere to and believe in the guidelines. As I listened to Mr. Kennedy today, it was disappointing because I think he's a serious guy, but he was not serious today. The reason I was most excited about him becoming HHS secretary was about food and looking at the food supply and trying to understand the connection between that and allowing people to live healthier lives. I didn't think he got to any of that. Much of the criticism, Greg, around vaccines that he encountered today, it was as much from Republicans as it was Democrats. In fact, the leader of the committee, Bill Cassidy, he was the one that said, you are denying people vaccines. That wasn't a Democrat. The first person to say that was Senator Cassidy. He was followed up by the senator from Wyoming and even Senator Tillis asking these questions. I was struck also, he was asked a question by a senator about mental health. And we talk a lot about mental health when guns are involved on campuses or in workplaces, and I think mental health is an issue. The administration cut Medicaid. The biggest provider, the single biggest payer for Medicaid services for young people in this country is Medicaid. Mr. Kennedy couldn't ask it. We answered that. We put up Senator Warner, who I thought asked questions about COVID and how many people died, how many people are going to see their increases in drug costs go up, seniors that is, next year. And Mr. Kennedy couldn't answer it. You can't be the HHS secretary. We poke fun at Jasmine Crockett, rightly so, when she can't answer basic questions, and even other Democrats. We have to be consistent. You can't be the HHS secretary and not know the budget for Medicaid, Medicare, or CDC. Finally, you can't blame. I don't mean to cut you up, but
how dare you?
I think it is nuts when people try to blame People try to blame what happened in Ukraine on Biden. It'd be like me trying to say that when COVID happened in America because President Trump was president, he's to blame for it. Of course he isn't. For the thing where he lost me today was when he blamed the CDC for 1 million or more deaths. I think you're right, Kennedy, and around the table, there are things they could have done better. But to blame the CDC, it was COVID, and we never got to the bottom of what China did in all of this.
Yeah.
I'm still a believer that because they won't let us in, that you have to assume there's some culpability on their part. None of those questions were answered by him. I thought he might have announced a big fentanyl campaign. We're going to try to get people to get off of drugs. But again, so I was disappointed today as I watched him.
Okay,
I didn't mean to cut you off.
No,
but
no,
I'm
it's okay. It's just that you did a list persuasion. You have a lot of things in there. And
we all did too.
I know, but I'm just saying that, like, he was being honest when he said he didn't know, because that's the right answer. You don't know about the deaths. The same, we were lied to about flu vaccines. How many people were killed by the flu every year?
No, you can blame them because they were qualifying.
COVID killed these people, not the CDC.
You came in with a gunshot wound, Harold, and if you had tested for COVID, you were marked down as a COVID death, so the hospitals could get more money. That's how it worked. It's already been exposed. Why am I the one exposing this?
Jesse,
you're always exposing.
As much as we want to be partisan sometimes, COVID killed these people, not the CDC.
I know, but
and
we don't have a full
have to
accounting
clarify
for it because they don't
You think
have
the
accurate
CDC killed them?
statistics.
You think the CDC killed it?
That's not what he said. He said we don't have an accurate count
he
because of the way
started
the
that.
hospitals jiggered with the numbers.
Well, we couldn't even have an honest discussion at the time because they were all the scientists who were mildly skeptical and reading the same data, who were pushing back against Anthony Fauci, were told they would have their funding taken away if they dared not toe the line. So we don't know some of those answers, unfortunately.
Yeah, in your face, Harold.
He said the
Time
CDC.
spot.
He said the CDC was responsible. I got it, but he said the CDC. He did say that, Jesse.
That's not a direct quote, Harold, but it's okay.
All right, Bill, back to our top story at this hour, the heated hearing between HHS Secretary Kennedy and Senate Democrats. One moment getting a lot of attention, Minnesota Senator Tina Smith pressing Kennedy about comments he made on our air after last week's deadly shooting at a Minneapolis Catholic school mass.
Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you...
So we pulled the tape. Here's Kennedy talking to Brian Kilmeade on Fox and Friends last Thursday, unedited. It runs about 2 minutes.
I know we're all watching this together, Mr. Secretary, and wondering how we would prevent it. And we're still trying to get a lot of answers to a ton of questions. But the one thing is clear. You are dealing with a person who's trans, that was transitioning. Are you going to be examining at all some of the drugs that are used in order to make that transition happening, to see if it plays a role? Because we also know there was a trans shooter in the Tennessee situation.
Yeah, we are doing those kind of studies now at NIH. We're launching studies on the potential contribution of some of the SSRI drugs and some of the other psychiatric drugs that might be contributing to violence. You know, many of them on there have black box warnings that warn of suicidal ideation and homicidal ideation. So we can't exclude those as a culprit, and those are the kind of studies that we're doing.
So I've never seen that medicine, but you're saying that if you get it, some of the side effects could be homicide, suicide?
Well, there are black box warnings on some of these psychiatric drugs that warn about, in their clinical trials, that they saw suicidal and homicidal ideation. So, you know, we are going into that with an open mind. We're looking, a lot of these studies have not been done in the past because of HIPAA regulations, which protect the privacy of patients. But it's something right now that we are looking at. We need to look at it, and we need to explain why all this violence is happening, and we need to look at every possibility.
And this just in, Vice President Vance has weighed in saying, quote, when I see all these senators trying to lecture and gotcha Bobby Kennedy today, all I can think is you all support off-label, untested and irreversible hormonal therapies for children, mutilating our kids and enriching big pharma. You're full of blank and everyone knows it.
Welcome back. Well, it was a fiery hearing on Capitol Hill today. HHS Secretary RFK Jr. testifying before the Senate Finance Committee, defending his overhaul of the CDC.
If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at the CDC. They did not do their job. I need to fire some of those people to make sure this doesn't happen again. That is what my job is. That's what my mission is. Eliminate the politics from science.
As you can imagine, that didn't go over well with Senator Elizabeth Warren.
Will you tell America that all adults and all children over 6 months of age?
It's not recommended for healthy people.
No.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
I don't know if you could hear that over the crosstalk. $855,000 from pharmaceutical companies. It's the accusation from RFK to Senator Elizabeth Warren. But she had her own supporters there, of course, in the Senate.
This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing.
You're interrupting me, and sir, you're a charlatan. That's what you are.
Let me speak slowly and clearly so that you can understand me through my New Mexico accent.
That last senator, oh no, he threatened not to give RFK Jr. his special memento.
2 young ladies in Las Cruces, New Mexico at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it.
He's not going to get the starfish? Here to react, physician and addiction medicine specialist, Dr. Drew Pinsky. Dr. Drew, it's great to see you here today. What do you make of all of this? RFK continued to point out chronic disease, chronic epidemic, and all that time those senators have sat there and oversaw this problem in our country.
That was precisely his point, but still devastation that he didn't get the starfish pen. I feel so terrible for him. The reality is he has never diverted from his message. World-class science, if people aren't coming along, or if they're politically motivated, or if they're ideologically encumbered, we have to move them aside. That's it, simple as that. Now, what I saw in this Senate hearing, I'm not sure, because as of somebody working in healthcare for 40 years, what I saw was obfuscation. These people were political grandstanding, that they wouldn't allow him to answer questions. They were just throwing out positions and accusations. And number 2, a grotesque lack of understanding of how our healthcare system works. Secretary Kennedy said a couple of times, you're making things up, and they were. They were absolutely making things up out of thin air. In fact, there was only one senator, well, 2, Ron Johnson, who actually demurred on the topic of healthcare, but he knew what he was talking about. But the only other senator that knew what he was talking about was the Rhode Island senator, who was talking about allocation of CMS resources and end-of-life care. He had very specific questions. They were extremely valid, and they will move the ball forward if we're able to do something about those things. The rest of this was strictly political and obfuscation.
And Dr. Drew, about the vaccine, primarily about the vaccine and CDC. Well, CDC is the Center for Disease Control. We have a chronic disease problem, not simply a problem of medicine, but a problem of chronic disease. And that's what he continues to bring up. And then when it comes to the solution, all they're focused on is the vaccine, which we should point out. In that cross-examination from Senator Warren, he said the boosters, for example, for COVID, are available. But that doesn't mean that I have to be required to recommend them for healthy or young people.
Look, Will, what does the CDC do? What is their function? Do you have any idea what their... No, that's part of what I was observing. Nobody seems to understand what the CDC role is in healthcare. Do you have any idea? We report on it all the time. Do you know what their original charter was and what they're supposed to do now?
Please share.
They originally were advising how to eradicate malaria. That was the original charter of the CDC. Now they are to advise, strictly advise. They're to oversee the public health system. Public health is not healthcare. It is not the healthcare system. It's an advisory panel to help physicians make decisions. And you know what the physicians at their liberty to do, regardless of the FDA, regardless of the CDC, is to do whatever he or she thinks is in the best interest of the patient sitting in front of them. That's it. That is our charge. I taught medicine for 20 years. Never once did I ask one of the residents, what the CDC tell you to do about that? I might have asked about CDC data, but the CDC is not healthcare. Public health is not healthcare, and people are terribly confused. And these senators are grotesquely confused about what these bureaucracies are charged to do.
Incredible, incredible insight. Great. Thank you so much, Dr. Drew.
We watched one heck of a hearing today. Democrats in that hearing unloading on Secretary Kennedy. Some even demanding that he resign as protesters interrupted his opening statement this way.
Kennedy, do you know some people will die between those three authorizations? You're killing billions of people.
So today's hearing landing as Florida moves to scrap all vaccine requirements.
So in moments, we'll hear from the CMS chief, Dr. Mehmet Oz, who will join us live. Stay tuned for that.
Let's first get to Senator John Cornyn, who was inside today's hearing, had a chance to question Secretary Kennedy. So, Senator, how did that go?
Its finest hour. The Senate used to be called the world's greatest deliberative body, but you wouldn't have known that from the hearing today. A lot of shouting, talking over each other. What I was interested in is getting answers to a lot of questions about Senator Kennedy's, Secretary Kennedy's service as head of HHS, but that was hard to come by given all the back and forth.
So, where do you believe all of this is ultimately going with vaccines, now with Florida scrapping its vaccine mandate? What do you think of that?
Well, my first question for Secretary Kennedy was, do you think COVID-19 was politicized? And of course, he answered yes and gave all the reasons why he held that opinion. But the truth is, the American people don't know what to believe because of the way the COVID-19 pandemic was treated in the world of politics. And one thing we must have learned, should have learned, is that politics and science don't mix. So various competing people claiming to have the science on their side are arguing one thing, and people on the other side are arguing something totally different. And public confidence has been shaken, and people don't know who to believe.
Yeah, in a similar message, but in a different way, that was shared by the former CDC director, Susan Minares, in a Wall Street Journal op-ed, where she said this: Robert F. Kennedy Jr., the CDC, and me. I served for 29 days as director of the Centers for Disease Control and Prevention. The Senate confirmed me to ensure that unbiased evidence serves our nation's health, and for doing that, I lost my job. America's children could lose far more. Do you share any of the same fears in the decisions that are being made?
Well, I don't think that fear is a great way to operate. And unfortunately, a lot of the allegations being made against Secretary Kennedy are designed to provoke fear, which is inconsistent with rational discourse. And I'd prefer to get to the bottom of it. There's maybe a good faith argument that we overprescribe vaccines. I believe doctors should be able to consult with their patients and make good medical decisions based on the health condition of that individual, whether it's a child or it's an adult. But I certainly prefer that to the sort of mandates we saw during COVID-19 and just shutting down our country, keeping our kids out of school, and devastating our economy.
Senator, as we mentioned, there were several fiery exchanges in that room. This one with Senator Michael Bennet, the Democrat from Colorado, with RFK Jr. Watch this exchange. I'll get your reaction. Okay, we're going to tee that up for you in a second. He was obviously challenged on many of the decisions that he has made and his vax policies and the shakeup at the CDC. Among them were a challenge on what this one senator described as lies coming from RFK Jr. All right, here it is. Listen.
What I said was accurate. What you said were lies. You
Are you
described
saying,
people
Senator,
moving the Titanic.
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the question, Chair.
You're evading that question.
What was your reaction when you heard that?
Well, when they're talking over each other and accusing each other of lying, it's not good. I think there's a way to get to the truth and to get to the bottom of it, but ultimately, those who call for the Secretary's resignation or being critical, ultimately the President of the United States is the one who makes that decision. The Senate's job is to consider the President's nominations and to confirm them or not, but once confirmed, the Senate's its role is basically accomplished. So it's really up to the President. If the President continues to have confidence in him, he'll continue to serve.
Okay, and I just want to finish off by saying he was also challenged by Senator Elizabeth Warren about vaccine availability. That has rendered a response from Walgreens, who has updated its statement on COVID vaccine access. Warren was challenging him in that room as to whether people can actually get access to these vaccines. Walgreens says this season's COVID vaccine has been approved for all adults ages 65 plus, and those under 65 with certain health conditions. Vaccine inventory will be arriving to our stores shortly. A lot more to dig into there, as we will. Senator, appreciate you joining us today. Thank you.
Thank you, Senator.
In the meantime, another huge story today. HHS Secretary RFK Jr. calling his shakeup at the CDC, quote, absolutely necessary. During a feisty face-off on Capitol Hill, some Democratic senators demanding that he outright resign, saying that he is putting Americans' health in danger. Secretary Kennedy accusing Democrats of, quote, crazy talk and making things up. Watch what happened in there earlier today.
We are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job.
Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening?
Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID? Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved lives?
That's the problem, is that they didn't have the data. The data by the Biden administration, absolutely dismal.
And you were sitting as Secretary of Health and Human Services? How can you be that ignorant?
Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
This is the current CDC recommendations for vaccines for children. On day number 1, they get their first jab, a hepatitis vaccine. By the time they're 18 months, they've had 18 jabs. By the time they get to be able to vote, they have 76 jabs.
So that last comment was from Kansas Republican Senator and Dr. Roger Marshall, who joins us now. Senator Dr. Marshall, very good to have you with us, sir. I want to ask you about the 76 jabs, because we've all, brought, many of us have brought a lot of babies into this world, 3 in my case, and they start getting these injections almost right away. And I want to talk to you about that. But first of all, I want to get your take on the overall atmosphere in there today, based on what you just listened to.
Wow. Secretary Kennedy has some of the thickest skin I've ever seen, that he's a fighter. I didn't realize how hard it was going to be to change America's sick care system into a health care system. Certainly, it was very, I think what
everyone goes to their instincts here. The Democrats' political instinct is to be the big brother. They want to be overly prescriptive. That here's all these vaccines that you can take. There's 20 vaccines, 76 shots. We want you to take every one of them. Secretary Kennedy and myself want more transparency. I want to present the evidence to you and your significant other and your children, how it applies to you. I don't know why they think everybody needs a hepatitis vaccine, every baby on day number 1. Yeah, I delivered a baby most every day for 25 years. If the mom had a negative hepatitis test, she's in a stable monogamous relationship, she's not doing IV drugs, there's no way that that baby's going to have hepatitis. We don't know what those 76 jabs are doing in that baby's immune system. So let's be a little bit more measured. Look, I'm a big fan of polio vaccinations, MMR, the DPT vaccines have done great work, but every person doesn't need every vaccine to be available. Let's be transparent, let's inform moms and dads and make decisions with your doctor. Democrats, they want to tell you what to do.
Yeah, you know, it's interesting to see the overall freak out because all of these vaccines are going to be available, right? I mean, if someone says, I want the hepatitis vaccine for my child, yes. You're just saying, you know, think about it, think about your own circumstances, whether or not it's a necessary vaccine for your child is something to consider. Let's watch another one of these exchanges. I was riveted by this hearing all morning this morning. This one is with Senator Bennett from Colorado. Watch this.
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked
Kennedy.
you a question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Well, you know what? I watch this and I see a lot of very good back and forth, to be sure. But I think that what we're seeing in terms of the pushback is conversation that people need to have in this country to make these decisions. This is about the mRNA vaccine, which was felt to be like, you know, a miracle development in record time during COVID. And I think most of us wanted that shot so we could get back to work, get back to our lives, and hopefully, you know, avoid this COVID virus. But what are your thoughts on mRNA now, Doctor and Senator, as you look at it? Do you have questions about side effects and who should be getting it and who shouldn't?
You know, absolutely, Martha. Look, Warp Speed was a miracle. What President Trump and his team accomplished was absolutely a miracle. We had a novel virus that nobody had ever seen. There was no immunity to it. It was made by a lab in Wuhan, and it was killing millions of people. So at the time, that vaccine was very important. Today, multiple of us have great immunity, and not everybody needs that vaccine right now. We should be very measured in who gets this.
All right, Senator Marshall, it's great to talk.
Let's begin with our senior congressional correspondent, Chad Pergram. He has more on what we just heard. Hi, Chad.
Hey there, guys. Good afternoon. This was a loud, contentious hearing, a long hearing, more than 4 hours here, with a lot of verbal brawling. In fact, there was one spectator in the audience who was ejected as soon as Secretary Kennedy began his remarks.
Kennedy, do you know some people will die between those three authorizations? You're killing billions of people. Prioritization.
Kennedy tangled with lawmakers who challenged the MAHA movement, but the biggest flashpoint was Kennedy's controversial guidelines on who can receive a COVID vaccine this fall.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
Republicans also had questions. North Carolina Republican Tom Tillis appeared baffled about where Kennedy stood on vaccines.
I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were there things that worked? Were there things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump and the mRNA platform.
Senators also drilled down on Kennedy's firing of former CDC Director Susan Menares. Kennedy told the committee she lied to him multiple times just weeks after Senate confirmation.
I voted for her. I made a mistake. I thought she could do the job. But unfortunately, she's not part of the president's mission of Secretary Kennedy turning this place, CDC, upside down.
Now, Mark Warner, the Democratic senator from Virginia, he asked Kennedy at one point how many people died during the pandemic. And Kennedy replied that he did not know. Warner was absolutely incredulous at that answer, saying you should know as Secretary of Health and Human Services. And Kennedy said that they didn't know the number because there was so much chaos at the CDC. Sandra, Bill, back to you.
All right, Chad, program live there for us. Thank you, Chad.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.